In 1896, a German surgeon did what every medical textbook said was impossible. He cut into a living human heart and sewed it back together while it was still beating. The patient was awake. There was no blood transfusion available. One wrong move, one torn suture, and the young man would bleed out on the table in seconds. This is the story of the first successful cardiac surgery in human history, told by the assistant who held the patient's shoulders while Dr. Ludwig Rehn opened his chest and reached inside. If you appreciate these deep dives into medical history's most pivotal moments, consider subscribing to support the channel. Now, let me take you into that operating theater in Frankfurt. My name is Wilhelm Baumer, and I was 24 years old when I helped kill a man by trying to save him. At least, that's what I believed would happen on the morning of September 7, 1896, when they carried Wilhelm Justus into the Städtisches Krankenhaus, Frankfurt. I had been Dr. Ludwig Rehn's surgical assistant for 18 months, long enough to know that my professor was both brilliant and dangerous in equal measure. The hospital staff called him Der Metzger, the butcher, though never within earshot. He had a talent for keeping patients alive through procedures that should have killed them, but his hands moved with such surgical confidence that even his failures seemed like medical victories postponed. Justus was a gardener, 22 years old, with earth still under his fingernails when the orderlies stripped him on the preparation table. He had been stabbed in a tavern brawl the night before, a single thrust from a kitchen knife that had penetrated his right chest wall. The blade had been thin, perhaps 4 inches long, and had entered between his 4th and 5th ribs. By all reasonable medical assessment, he should have been dead before dawn. The human heart sits in a cage of bone and muscle specifically designed by God or evolution or blind chance to protect it from exactly this type of injury. When that protection fails, death follows with mechanical certainty. But Justus was still breathing when they brought him to us, though each breath sounded wet and labored. His skin had the grayish-blue tint of severe blood loss, and his pulse was threading away like a candle in wind. Dr. Rehn examined him in the pre-operative room while I prepared the surgical instruments, laying them out on boiled linen with hands that wanted to shake but had been trained not to. "The pericardium is filling with blood," Rehn said, his fingers pressing carefully around the wound site. "Cardiac tamponade. The heart is drowning in its own blood, compressed in its sac. He has perhaps 2 hours, maybe less." "Shouldn't we simply drain the pericardium?" I asked. "Release the pressure?" Rehn looked at me with those pale gray eyes that never seemed to blink during surgery. "And if the heart itself is torn? If we drain the blood, we create a path for the heart to pump itself empty directly into the chest cavity. He would exsanguinate in minutes." "Then what do you propose?" "I propose we repair the heart in," he said simply, as if suggesting we set a broken finger. The operating theater at Frankfurt was a circular room with tiered wooden benches rising toward a glass ceiling that let in the morning light. On clear days, the sun illuminated the surgical table like a stage, which is exactly what it was. Medical students and visiting physicians would crowd the benches to watch Dr. Rehn perform his procedures. On this morning, only 4 other people were present: myself, Sister Agnes, the surgical nurse, Dr. Hermann Stolz from the university medical faculty, and a young medical student named Friedrich, whose surname I never learned because he vomited and fled before the surgery was 15 minutes old. We had given Justus a local anesthetic, cocaine solution injected around the wound site and into the chest wall muscles. His eyes were open, watching the ceiling, and I could see his pupils dilating and contracting with each wave of pain or fear or both. There was no general anesthesia available that was safe enough for a man already in shock from blood loss. Chloroform or ether might stop his heart entirely. He would feel everything. "Can you hear me, Herr Justus?" Rehn asked, leaning over the patient. The gardener's lips moved. "Yes, Herr Doctor. I'm going to open your chest and repair the damage to your heart. You will feel pressure and pulling, but the cocaine should prevent the worst pain. You must remain absolutely still." If you move during the critical moment, I will cut something I cannot repair. Do you understand?" "I understand." "Herr Baumer will hold your shoulders. Sister Agnes will monitor your pulse. You may scream if you need to, but you must not move." Justus nodded fractionally. I moved to the head of the table and placed my hands on his shoulders, feeling the trembling in his muscles, the rapid flutter of his pulse visible in his neck. His skin was cold and damp. Rehn made his first incision at exactly 9:47 in the morning. I know the time because Dr. Stoltz was taking notes, recording everything for the medical journals. The incision extended the stab wound, cutting through skin and muscle and the intercostal tissues between the ribs. Blood welled up immediately. Dark venous blood mixed with the brighter arterial flow. Sister Agnes sponged it away with practiced efficiency, but it kept coming. "Might be rib spreader," Rehn said, and Agnes handed him the metal device that would crack Justus's chest open like a walnut. The ratcheting sound of the spreader widening the incision was clearly audible in the quiet theater. Justus made a sound between his teeth, not quite a scream, more like air being forced through a narrow gap. His shoulders tensed under my hands, rigid as iron. "Still," I whispered to him, "stay still." The pericardium came into view, a glistening sac of membrane that surrounded the heart, now bulging and tense with accumulated blood. It was supposed to be translucent, barely visible. Instead, it looked like an overfilled wineskin, dark purple and straining. I could see the heart beating inside it, a shadow moving behind the blood-filled membrane. "Scalpel," Rehn said. He pierced the pericardium with a single careful cut, and blood fountained upward in a jet that splashed across his surgical gown and spotted Dr. Stoltz's notepad. Agnes moved instantly with the suction tube, but there was too much blood. It poured out of the chest cavity and ran off the edges of the table, pooling on the floor and spreading circles. And then I saw it, the human heart, exposed to air and light, beating in its opened cage. I had seen hearts before. Every medical student dissects cadaver hearts, learns the chambers and valves, traces the coronary arteries with probe and scalpel. But those are still hearts, gray and rubbery, preserved in formalin. This was different. This was a living organ doing its work, contracting and relaxing in steady rhythm, pumping blood that immediately leaked from a small tear in the right ventricular wall. The wound was perhaps 1.5 centimeters long, a small gash in the thick muscle of the heart's wall. With each contraction, blood spurted from the tear in a pulsing jet, bright red arterial blood mixing with the darker venous flow. The heart was trying to kill the man who owned it, pumping his life away with each beat. "Silk suture, curved needle," Rehn said. His voice was perfectly calm. His hands were steady. This was the moment that separated us from every surgeon who had come before. The heart was untouchable. That was medical dogma dating back to Hippocrates. "Wounds of the heart are always fatal," the textbook said. Theodor Billroth, the father of modern surgery, had declared in 1883 that the surgeon who attempts to suture a heart wound deserves to lose the respect of his colleagues. Only 13 years later, we were about to prove him wrong or die trying. Rehn grasped the heart with his left hand, actually held it, cradled it like a bird, and tilted it slightly to expose the tear. Justus screamed. The sound was high and thin, a sound I had never heard a grown man make. His shoulders bucked under my hands, and I pressed down hard, using my full weight. "Hold him," Rehn snapped. "I'm holding him." Sister Agnes moved to Justus's legs, pressing them flat. The young student Friedrich was making choking sounds in the corner. Dr. Stoltz had stopped writing and was simply staring, his pen frozen above the page. Rehn pushed the curved needle through the heart muscle on one side of the tear. The heart contracted in his hand, squeezing blood through the wound and over his fingers. He pulled the silk through and placed the second stitch, then the third. Each stitch had to be placed perfectly, deep enough to hold the muscle tissue, shallow enough not to penetrate the heart's inner chamber. Too deep, and the suture would create a new path for blood to leak through. Too shallow, and the stitches would tear out when the heart contracted. The heart beat against his fingers. I watched it contract and relax, each movement working against the repair he was trying to make. It was like trying to sew a sleeve while someone was wearing it, except the sleeve was pumping blood and the wearer would die if you made a mistake. Justus had stopped screaming. His breathing was rapid and shallow, his face the color of old parchment. Sister Agnes checked his radial pulse and shook her head slightly. It was weakening, fading. We were losing him. Rehn placed the 4th stitch, the 5th, the 6th. His movements were quick now, efficient, racing against the patient's failing circulation. Blood was still leaking from the wound, but less with each suture. The tear was closing. "Last stitch," he said. He pulled it tight, knotted the silk, and cut the excess thread with surgical scissors. Then he released the heart, simply let go and stepped back, and we all watched to see if it would continue beating or simply stop. It beat. Once, twice, 3 times. The sutured tear held. Blood was no longer spurting from the wound. "Pulse is strengthening," Sister Agnes said quietly. Dr. Rehn looked at his hands. They were covered in blood up to the wrists, the bright arterial red of a living heart. He had just done something no human being in history had successfully done before. He had cut into a beating heart, repaired it, and the patient had survived. We still had to close the chest, of course. We still had to manage the risk of infection, the possibility of pneumothorax, the 100 complications that could kill Justus in the hours and days ahead. But in that moment, standing in a theater with blood pooling on the floor and a gardener's heart beating steadily in his open chest, we had crossed a threshold that separated the medical past from the medical future. Justus opened his eyes and looked at Dr. Rehn. "Is it finished?" he whispered. "The heart is repaired," Rehn said. "Now we wait and see if the rest of you survives it." Justus did not die on the table, which was the first miracle. He did not die in the recovery ward in the first 6 hours, which was the second. By midnight, when I should have gone home to my lodgings on Schillerstrasse, I was still sitting beside his bed with Sister Agnes, watching the rise and fall of his bandaged chest, waiting for the catastrophic hemorrhage or infection that medical literature promised was inevitable. The ward was a long room with 12 beds, though only 5 were occupied that night. Gas lamps turned low cast a yellow light that made everything look jaundiced and unreal. The other patients were asleep or pretending to be, a man with an amputated leg, another recovering from an abdominal surgery, 2 with pneumonia who breathed with wet, rattling sounds. The night nurse, Sister Margaret, moved between them like a ghost, checking pulses and adjusting blankets. Justus was awake. His eyes were open, staring at the ceiling, and occasionally his lips would move as if he were counting something or praying. The cocaine had worn off hours ago, and we had given him morphine for the pain, but not too much. We needed him conscious enough to tell us if something was going wrong inside his chest. His heartbeat was visible through the bandages, a steady rhythm that seemed impossible given what we had done to him. "Does it hurt?" I asked him, keeping my voice low. "Everything hurts," he said. His voice was hoarse from screaming. "But it's different now. Before it felt like something was crushing my chest from inside. Now it just aches, like I've been beaten." "That's good," Sister Agnes said. "Pain means the nerves are intact. Pain means you're alive." "I felt him touch it," Justus said suddenly. "My heart. I felt his hand on it." I didn't know what to say to that. What could I say? "Yes, you felt a surgeon's hand wrapped around your beating heart because that actually happened to you, and you will carry that memory until you die, which might be tomorrow or might be in 50 years, and we have no way of knowing which." Dr. Rehn came to the ward at 2 in the morning, still wearing the same blood-stained surgical gown he had worn during the operation. He had been in his office, writing up the case notes, documenting everything while the details were fresh. He examined Justus with careful thoroughness, checking the surgical dressing, listening to the heartbeat with his stethoscope, palpating the chest wall for signs of fluid accumulation or subcutaneous emphysema. "Temperature?" he asked. Sister Agnes consulted her chart. 37.4 Celsius, slightly elevated but not concerning. "Pulse?" 92, strong and regular. Rehn nodded slowly. He looked exhausted, I realized. There were dark circles under his eyes, and his hands trembled slightly as he folded his stethoscope. He had just performed a surgery that could make him famous or destroy his reputation, and he wouldn't know which for days or weeks. "The next 48 hours are critical," he said, speaking to me but loud enough for Justus to hear. "Infection is the primary risk. The heart wound itself should hold if the sutures were placed correctly, but the chest cavity was open to air for nearly 30 minutes. Any contamination could lead to sepsis or empyema." "I understand," Justus said. Rehn looked at him directly for the first time. "You're a strong man, Herr Justus. Your heart survived a knife wound and a surgical repair, but surviving the next 2 days will require equal strength. If you develop fever, chest pain that worsens, difficulty breathing, or confusion, you must tell the nurses immediately. Do you understand?" "Yes, Herr Doctor." "Good." Rehn paused, then added quietly, "You are making medical history, whether you live or die. I thought you should know that." After he left, Justus was quiet for a long time. Then he said, "I don't want to make history. I just want to go back to the gardens." The second day after surgery brought the fever. It started in the early afternoon. Justus complained of feeling cold despite the warm September weather, and when Sister Margaret took his temperature, it had climbed to 38.6 Celsius. By evening, it was 39.2, and he was shivering so violently that the bed frame rattled. Dr. Rehn ordered cold compresses and increased monitoring. I volunteered to take the night watch again, partly from genuine concern and partly because I knew I wouldn't sleep anyway. I kept seeing the heart in my mind, that glistening red muscle contracting in Rehn's hand, the silk sutures pulling the torn edges together, the terrifying beauty of a living human heart exposed to light and air. "Am I dying?" Justus asked me around midnight. His teeth were chattering. "The fever is your body fighting infection," I told him. "It's a good sign, in a way. It means your body is trying to heal." "That's not what I asked." I looked at him, really looked at him for the first time as a person rather than a surgical case. He was young, my age or younger, with a laborer's calloused hands and a face that had probably been handsome before fear and pain had hollowed it out. He had been stabbed in a tavern fight over something that probably didn't matter, a woman, an insult, a few coins. Now he was lying in a hospital bed with his chest sewn together and his heart beating against surgical silk, waiting to see if he would survive becoming a medical experiment. "I don't know," I said honestly. "No one has ever survived what you survived. We have no precedent, no case studies, no statistical data. You are the first. Then I could die. Yes. But I could live. Yes." He closed his eyes. "Then I choose to live." As if choosing had anything to do with it. As if will alone could keep infected tissue from turning septic, could keep the heart beating against the foreign material of surgical sutures, could force the body to heal from an injury that every medical authority said was unsurvivable. But perhaps he was right. Perhaps choosing mattered more than we knew. The fever broke on the third day. I wasn't there when it happened. I'd finally gone home to sleep for a few hours, but Sister Agnes told me about it later. Justus had been delirious through the night, talking to people who weren't there, reaching for things in the air above his bed. His temperature had climbed to 40.1 Celsius, high enough to cause brain damage, high enough to kill. Dr. Rehn had been preparing to open the chest again, to drain what he assumed was an abscess or empyema, when suddenly Justus had opened his eyes, looked at Agnes with perfect clarity, and asked for water. His temperature was 37.6 Celsius. The fever had broken like a wave crashing and then receding, leaving him weak and drenched in sweat, but alive and conscious. When I returned to the ward that afternoon, he was sitting up in bed, sipping broth that Sister Margaret had brought from the hospital kitchen. His color was better, still pale, but no longer the gray-blue of imminent death. The surgical dressing had been changed, and there was no sign of purulent discharge or spreading infection. "Welcome back," I said. He smiled weakly. "I'm told I missed some excitement." "You had a fever high enough to cook an egg," Dr. Rehn thought he might have to operate again. I remember some of it. I remember seeing my mother, but she died 5 years ago. I remember thinking I was in the garden, planting roses. He paused. I remember feeling my heart beating and being surprised that it was still working. Over the next week, Justus continued to improve. The surgical wound showed no signs of infection. His heartbeat remained strong and regular. He began eating solid food, then sitting in a chair beside the bed, then walking slowly around the ward with Sister Agnes supporting his arm. Each day he was alive was another day that contradicted centuries of medical certainty. Dr. Rehn examined him daily, documenting every detail. Other physicians came to observe, first from our own hospital, then from the university, then from other cities. The news was spreading through medical circles. A surgeon in Frankfurt had successfully repaired a wounded heart, and the patient had survived. It seemed impossible, but the patient was walking and talking and very much alive. 2 weeks after the surgery, Dr. Rehn allowed me to remove the stitches from Justus's chest wall. The deeper sutures, the ones holding his heart together, would remain permanently. They were made of silk that the body would eventually encapsulate in scar tissue, becoming part of his heart muscle forever. But the external sutures could come out. I worked carefully, using small scissors to cut each thread and forceps to pull it free. The incision had healed cleanly, leaving a red line that would eventually fade to white. Beneath the scar, I could see the steady beat of his heart, visible through the skin and muscle, a reminder that something impossible was happening inside his chest with every passing second. "What will happen to me now?" Justus asked. "You'll continue to heal. In another week or two, you should be strong enough to leave the hospital. And then? Then you go back to your life. Back to the gardens, if that's what you want." He was quiet for a moment. "Will my heart always feel different? Will I always know it's been cut and sewn back together?" I finished removing the last stitch before answering. "I don't know. You're the first person in history to survive this injury and this surgery. You're the only person who can answer that question, and you'll spend the rest of your life discovering the answer." He touched his chest gently, fingers tracing the line of the scar. I can feel it beating. It feels, I don't know, like it's not quite mine anymore. Like someone else's heart inside my chest. "It's your heart," I said firmly. "It was always your heart. We just helped it keep beating." But I understood what he meant. How could you feel the same after knowing that your heart had been stopped, held in someone's hand, stitched together like torn cloth? How could you trust your body the same way, knowing how fragile the boundary was between life and death, knowing that you had crossed that boundary and somehow returned? That night I found Dr. Rehn in his office, writing another letter to the medical journals. He looked up when I entered. "He's going to live," I said. It wasn't a question. "It appears so. Barring unforeseen complications, Herr Justus should make a full recovery." "You did something impossible." Rehn set down his pen. "I did something that had never been done successfully before. That's different from impossible. The heart is an organ like any other, muscle, blood vessels, connective tissue. It can be injured, and therefore it can be repaired. We simply had to be brave enough or foolish enough to try. And now? Now other surgeons will try. Some will succeed, others will fail. The technique will be refined, improved, made safer. In 20 years, cardiac surgery will be routine. In 50 years, they'll be doing things we can't even imagine, replacing valves, bypassing blocked arteries, perhaps even transplanting entire hearts from one person to another." He said it so matter-of-factly, as if the future of surgery was already written and we were just reading ahead. Perhaps for him it was. Wilhelm Justus left the Städtisches Krankenhaus Frankfurt on October 2, 1896, 25 days after a kitchen knife had pierced his heart and 25 days after Dr. Ludwig Rehn had sewn it back together. I walked with him to the hospital entrance, carrying the small bundle of his personal effects, the clothes he had worn the night of the stabbing, laundered and mended by the hospital staff, and a letter from Dr. Rehn documenting his medical history in case he ever needed treatment from another physician. He moved slowly, favoring his left side slightly, but he was walking on his own strength. His color was good. His breathing was unlabored. By every measurable standard, he was a healthy 22-year-old man, except for the fact that his heart contained permanent silk sutures and his chest bore a scar that would mark him for life. "Where will you go?" I asked him at the entrance. "Back to the Rothschild Gardens," he said. "They kept my position open. Said they'd heard about the surgery, about what happened. They want me back." "And the man who stabbed you?" Justus' expression darkened slightly. "In prison, I'm told. I don't remember much about that night. I remember arguing about something. A woman, maybe, or cards. I remember the knife going in, and then everything became very cold and distant. The next clear memory I have is waking up on your surgical table and seeing all of you standing over me. You were very brave during the surgery. I was terrified. I'm still terrified, if I'm honest. Every time my heart beats faster, when I climb stairs or move too quickly, I wonder if this is the moment the stitches tear, if this is when everything comes undone." He touched his chest unconsciously. "Dr. Rehn says the silk will hold, that my heart muscle will grow around it and make it stronger. But how does he know? I'm the first, remember? There's no one to ask what happens in 5 years, in 10 years, in 20. I didn't see Justus again for nearly 3 months. My work at the hospital continued. There were other surgeries, other patients, the endless cycle of injury and illness and attempted healing. Dr. Rehn had become something of a celebrity in medical circles. Letters arrived from surgeons across Europe asking for details of the technique, requesting permission to visit and observe. Rehn published his case report in the Central Journal for Surgery in December, describing every detail of the procedure with clinical precision. But I thought about Justus often. I wondered if his heart was still beating steadily, if the sutures were holding, if he had returned to his normal life, or if he was forever changed by what had happened to him. In January of 1897, I learned the answer. I was walking through the Palmengarten on a cold Sunday afternoon when I saw him. He was working in one of the rose gardens, pruning dormant bushes in preparation for spring growth. He wore heavy gloves and a thick coat against the winter wind, and he moved with the easy confidence of someone who had done this work all his life. He looked healthy, strong even. If I hadn't known about the scar beneath his shirt, I would never have suspected he had been a surgical patient 4 months earlier. "Herr Justus," I called out. He turned and recognition crossed his face. "Herr Baumer, I didn't expect to see you here. I come here sometimes to walk and think. How are you? How's your health?" "Good. Very good, actually." He set down his pruning shears and pulled off his gloves. "The doctors at the hospital told me to return for follow-up examinations every month. They listened to my heart, checked the scar, asked me questions about pain or shortness of breath. So far, everything is normal." "May I?" I gestured toward his chest. He unbuttoned his coat and shirt enough to expose the scar. It had faded from angry red to pale pink, a clean line bisecting his chest. I could see his heartbeat, steady, strong, regular. Beneath that skin and muscle and bone, silk threads woven by human hands, held together the muscle that kept him alive. "Does it hurt?" I asked. "Sometimes. When the weather changes, or when I work too hard. But it's manageable. Mostly I just feel it. All the time. I'm aware of my heart in a way I never was before. Every beat reminds me of that day, of Dr. Rehn's hands inside my chest." We walked together through the winter garden while Justus told me about his return to normal life. The other gardeners had been curious about his surgery, asking to see the scar, wanting to know what it felt like to have your heart touched by a surgeon's hand. Some treated him with superstitious awe, as if he had died and been resurrected. Others simply accepted his return with practical indifference. He could work, therefore he was useful, and that was all that mattered. "The strangest part," he said, "is knowing that I'm being watched, not just by the doctors at the hospital, but by medical science itself. Dr. Rehn told me that other surgeons are attempting similar procedures now, trying to replicate what he did. Some of their patients survive, others don't. Every day I'm alive, I'm proof that it's possible. Every day I'm alive, I'm making other surgeries more likely to succeed. Does that bother you? I don't know. It feels like a responsibility I didn't ask for. Like I have to stay healthy not just for myself, but for everyone who comes after me. He paused beside a frozen fountain, his breath visible in the cold air. Do you know what I dream about sometimes? I dream that I'm back in that tavern, and the man with the knife is there, and I have a choice. I can step aside and let him stab someone else, or I can take the knife and become the first person to survive a heart surgery. In the dream, I always step aside. I always choose not to be special. But you didn't have that choice in reality. No, the choice was made for me by a drunk man with a knife, and a surgeon brave enough or crazy enough to try something impossible. He smiled slightly. And here I am, alive and pruning roses in January. It's not the life I imagined for myself, but it's a life I wouldn't have at all without Dr. Rehn. We talked for another hour before I had to leave. As I walked away, I looked back once and saw Justus returning to his work, moving among the dormant rose bushes with patient care. He looked like any other gardener, any other young man earning his living through manual labor. But he wasn't. He was a miracle, a medical impossibility made real, a man whose heart had been pierced and repaired and was still beating strong. In March of 1897, Dr. Rehn performed his second cardiac surgery, a 30-year-old butcher with a stab wound to the left ventricle. The patient died 3 days later from infection, despite the surgical repair being technically successful. The heart had held together, but the body had failed. Rehn was devastated. I found him in his office after the death, staring at his hands as if they had betrayed him. I thought I had learned something, he said. I thought Justus's survival meant I had discovered a technique that could be replicated. But perhaps he simply got lucky. Perhaps his youth and his strength carried him through despite my surgery, not because of it. You saved his life, I said firmly. Without your intervention, he would have died in hours. You gave him a chance, and his body was strong enough to take it. That's not luck. That's medicine. 1 success and 1 failure. 50% mortality. Would you take those odds if it were your heart being cut open? I thought about Justus working in the garden, about the steady beat of his heart beneath the scar, about his admission that he dreamed of stepping aside and letting someone else be the first. If the alternative was certain death, yes, I would take those odds. Rehn performed 6 more cardiac surgeries over the next 2 years. 3 patients survived, 3 died. His technique improved with each procedure. Other surgeons began attempting similar repairs in Vienna, Berlin, Paris, London. Some succeeded, others failed. But slowly, very slowly, cardiac surgery stopped being an impossible dream and became a dangerous reality. And through it all, Wilhelm Justus continued to tend his gardens, his heart beating steadily against the silk sutures that had become part of his living tissue. Proof that the human body could be opened, repaired, and closed again. Proof that the heart, for all its symbolic importance as the seat of life and love and emotion, was ultimately just another organ, complicated and vital, but not untouchable, not beyond the reach of surgical intervention. I left Frankfurt in 1899 to study with a cardiac specialist in Vienna, but I maintained correspondence with several colleagues at the Städtisches Krankenhaus. Through these letters, I learned that Justus continued his regular follow-up examinations for 3 years, then gradually stopped coming. The doctors assumed he was healthy and had simply moved on with his life, preferring to forget his brush with death rather than be continually reminded of it by medical checkups. I often wondered what happened to him. Did he live to see the 20th century? Did his repaired heart keep beating through the decades, or did it eventually fail in some way that Dr. Rehn's 1896 surgery couldn't prevent? Did he marry, have children, pass on his story to grandchildren who would find it impossible to believe? Or did he die young, his heart giving out years before its time because of the trauma it had endured? I never learned the answer. Hospital records from that era are incomplete, and I was never able to trace Justus after he stopped his follow-up appointments. But sometimes, even now, when I listen to a patient's heartbeat through my stethoscope, I think about that September morning in 1896. I think about a young gardener on a surgical table, awake and terrified, feeling a surgeon's hand wrap around his beating heart. I think about silk sutures pulling torn muscle together, about blood pooling on the floor, about the moment we all held our breath and waited to see if the heart would continue beating or simply stop. It beat. That's what I remember most. Against all historical precedent, against every medical textbook and authority figure who said it was impossible, it beat. The heart beat, and the gardener lived, and medical science learned that the boundary between possible and impossible was not fixed, but movable. That lesson, more than any specific surgical technique, was Dr. Ludwig Rehn's true gift to medicine. He showed us that the question was never, can this be done, but rather, who will be brave enough to try? Wilhelm Justus was brave enough to survive. Dr. Rehn was brave enough to attempt the impossible. And in a circular operating theater in Frankfurt, with morning light streaming through the glass ceiling and blood pooling on the floor, they together changed what it meant to be a surgeon, to be a patient, to be human. The heart still beats. Even now, more than a century later, somewhere in the world, a surgeon is opening a chest cavity and reaching toward that miraculous organ, guided by techniques refined through countless trials and failures, built on the foundation of that first successful repair. And every patient who survives cardiac surgery, every valve replacement, every bypass, every transplant, owes something to a 22-year-old gardener who lay on a table in 1896 and didn't die when he should have. That's the story worth remembering. Not just the technical details of the surgery or the medical breakthrough it represented, but the human reality beneath it. A young man who wanted to go back to his gardens, a surgeon who refused to accept that hearts were untouchable, and the moment when human courage and surgical skill converged to prove that the impossible was simply the possible waiting for someone brave enough to try.